Mr. Jones, this must all be very overwhelming. Let me explain what is going on inside your body. Hypertension, or high blood pressure, is a measure of the force against the arterial walls inside your body. To be diagnosed with hypertension, you must have a prolonged blood pressure that is over 130/80. This is normally kept in check by your heart, blood vessels, kidneys, and hormones all working together. These systems are in place to keep your blood pressure under 130/80, but something isn't working right in your body. The first type of hypertension is called primary hypertension. This is where there are multiple causes to the elevated blood pressure and not one clear identified cause. This type of hypertension comes on gradually, and often you don't even feel it. Up to 95% of people with hypertension have this type of hypertension. Providers used to try to find the cause of primary hypertension, but it has been proven that that is not effective, so we treat it regardless of the cause. Primary hypertension is multifactorial, and there are things that you can do to help control it. These things include maintaining a healthy weight, staying physically active and exercising, stopping nicotine and alcohol use, following a low-sodium diet, and lowering your stress level wherever it's possible. When you are obese or overweight, your excess fatty tissue can cause high blood pressure. Exercise decreases your insulin resistance and helps you maintain a healthy weight. Insulin resistance can lead to high blood pressure. Nicotine raises your blood pressure when you use it. Eliminating it will lower your blood pressure. Following a low-sodium diet will help keep your fluid levels in your body where they should be, helping keep your blood pressure under control. Stress can raise your blood pressure because of the fight or flight response. Another type of hypertension is called secondary hypertension. This is high blood pressure caused by an identified source. We'll talk about the three of the most common causes. When your kidneys aren't working right, it can cause hypertension. Kidneys are responsible for managing fluids, sodium levels, and hormone releases. When the blood vessels within and around the kidneys become stiffened, narrowed, and damaged, it decreases the blood volume that gets to the kidneys. This causes the kidneys to release the hormone that tells the kidneys to hold on to sodium and fluid in the body, which raises blood pressure. Excessive or high levels of insulin in your body can also affect blood pressure. This is caused by insulin resistance. Too much insulin signals for the kidneys to hold on to sodium. Too much insulin can also trigger your fight or flight response, which causes vasoconstriction, which elevates your blood pressure. Finally, too much insulin causes blood vessels to stay stiffened, which will elevate your blood pressure. Sleep apnea is the third most common cause of secondary hypertension. The repeated low oxygen levels in your body release a hormone that tells your blood vessels to stiffen. Now, these are just three common causes of hypertension. These are not the only ones. There are over 100 different genes that could affect your blood pressure. The last type of hypertension is called complicated hypertension. You have this type because you are classified as high risk due to you being African American. High risk patients, which include African American and elderly, are classified as complicated hypertension because their blood pressure can be harder to manage. Another factor that would get you diagnosed with complicated hypertension is to have evidence of organ damage from their hypertension. This could include vision issues, weakness from a stroke, chronic kidney disease, or even heart failure. I am most concerned about your weight gain and shortness of breath with activity. I feel that is the most significant symptoms you are experiencing. To be frank, these could be signs of early heart failure. I'm concerned your long-standing hypertension has caused damage to your heart because the chronically elevated pressures lead to brittleness in your vessels and heart. This doesn't allow your heart to pump effectively. This also signals to your kidneys to retain sodium and fluid, increasing levels in your body. This leads to a compounding effect on your heart, worsening your heart failure. The most concerning effect of sustained, complicated primary hypertension, which is what you have, is called sudden cardiac death. This could happen with severe heart failure from hypertension. This is caused by chronically elevated pressure in your arteries, leading to increased work in your left ventricle. The left ventricle is the last stop for the blood in your heart before it goes out to the aorta. When pressures are elevated, this leads to ventricle stiffening and thickening. This inhibits normal function of the ventricle, leading to failure. The medical term for this is left ventricle hypertrophy. A major symptom of this is an arrhythmia, which is an abnormal heart rhythm, which can cause sudden cardiac death. Now, to lighten it up, there are things you can do to modify your risk of having organ damage and lower your risk of sudden cardiac death. It's best to start in a slow, sustainable way. Make changes you can stick with. Slowly wean down the number of cigarettes you smoke a day and beers you drink till you have quit. Switch to low sodium options when you can. Read labels to make sure you stay under the recommended 1,500 milligrams of sodium a day. Start being active by going on walks and increase as you feel able. Ask for help if things feel overwhelming. You can do this.